Chief Robert F. Kennedy Jr. was pressed today. This is his first testimony since his confirmation. And take a listen to this exchange.
My opinions about vaccines are irrelevant. I've directed Jay Bhattacharya.
Sure. No, like I said, I don't want to.
So that everybody can make that decision. But I don't want to seem like I'm being evasive.
Yeah.
But I don't think people should be taking advice, medical advice from me.
Don't take medical advice from RFK Jr. That actually marks him backing down because both in his public advocacy before this job and in the beginning of this job, he did confuse or conflate things for people by talking a lot about his vaccine skepticism. And when you are the health secretary, that's going to have an impact, including people thinking they're getting medical advice from you. Now, we actually spoke to Dr. Mehmet Oz, who runs Medicare, Medicaid under RFK Jr. This was just last night. And he also found a line that was somewhere short of RFK's misleading vaccine skepticism.
There are adverse events from the vaccine. It does cause deaths every year.
Is what RFK is saying in public interfering with what you and Medicaid are doing in providing that vaccine? And what would you say families should do?
Well, Secretary Kennedy is standing up for choice. He's saying you have the option. You do what you think is best. Most families do vaccinate their kids. Do your homework, not just on vaccines, but all the other things having to do with the well-being of your family.
And you think that's a good idea?
I think it's a good idea, but it's up to every family, depending on what other issues are happening in their lives.
A good idea. This scene that played out was some of the protests today.
No clinical trials should be affected by the cuts.
They are impacting clinical trials.
They don't want the choice to be uninsured.
Well, but
they don't want the choice to die because they don't get to a doctor on time.
Americans prefer private insurance.
You are willfully destroying programs that keep children safe.
Are you recommending the measles vaccine?
I am not going to just tell people everything is safe and effective if I know that there's issues.
That's really dangerous for the American public.
That was some of the back and forth. We are joined now by Zeke Emanuel, the former Obama White House health policy advisor, a doctor who's also dealt with the intersection of government guidance, testimony, and medicine. Welcome.
Nice to be here, Ari.
Let's start with the slight backing down, or others would call it double talk, on vaccines, because RFK has contributed to a lot of the skepticism. He has a platform now. He has government medical oversight powers. And yet he also did seem to back off it a little bit. And the Medicaid chief, Dr. Oz, also didn't want to really be misheard there. And I think maybe there's a silver lining that he said, yeah, no, it is usually a good thing. Your thoughts on all of that?
Well, one of the things we know is that his entire persona has been anti-vaccine. People had to pull out of him, yes, you should get the measles vaccine in Texas. And then he quickly said, well, you know, vitamin A really protects you, which is not consistent with the data that we have. And we know it's had a big effect. Vaccination rates have gone down. People have, parents have actually listened to RFK Jr. and decided not to get their kids vaccinated. And here's one of the things he didn't say. All of this choice has a very negative consequence. If the population if 95% of the population isn't vaccinated against measles, you get outbreaks. And you get outbreaks in various pockets. And we've had those outbreaks, Texas, Orthodox Jewish community, Mennonite communities. And unfortunately now we have children dying from that. And by the way, let me just say one other thing, Ari, which has gotten almost no attention. The MMR has that R, the rubella vaccine. If people don't get the rubella vaccine, that's German measles, and women get pregnant who don't have the vaccine, get rubella, you have babies with serious malformations, small heads, developmental delays, and many other things. And we're waiting, fearing the moment when we'll have an uptick in rubella, and that would be a disaster.
I appreciate you reminding people with clear language. This is avoidable stuff. You know, everyone's got problems in life that feel unavoidable. This is avoidable. So your view is it? You give him what, 10, 15% improvement? Do you think it's better, even as others, as you say, have heard this, and the way they kind of blur it and muddy it makes it sound like, oh, it's a choice, so you'll see?
I'm a professor, and I wouldn't give a very high grade to that performance. You know, he's trying to hide behind this language of choice and the fact that no one should listen to me when he has, you know, basically canceled some vaccination trials. He's closed down the Vaccine Research Center at the NIH. It's pretty clear what the intention is.
Gotcha. Yeah, it's concerning. The other big healthcare news coming out of the administration this week is that they say they want to lower drug prices by kind of pushing the companies. Here's what Medicaid Chief Dr. Oz told me about that.
There have been 5 companies that have already approached CMS, and they recognize that it's not right, that it's not fair. They were paying that much more in this country.
Can you name any of those companies that you say reached out?
I'm not going to name them because it's all confidential right now.
Dr. Emanuel, in a world of wide disagreements, it appears that at least on the political messaging, your old boss's Obama-Biden era and this new Trump era, everyone wants to say the drug prices are too damn high. Okay. But do you see anything in this order that is real, that will work?
So far, no. You could have this most favored nation pricing, which is you go to a basket of countries and you get the lowest price or you get the average price. A lot depends upon the details. That's the first thing. The second thing is most analyses of those show that American drug prices will fall 7.5%, not the 80-90% that President Trump was blaring out. There's no chance that he's going to reduce the brand name drug prices by 80 or 90%. This is a pretty complicated area, which price you use. There are many different prices. As we know, there's a Medicare price, a Medicaid price. In this country, you have different prices and confidential rebates in other countries. Very complicated. I think there is a policy. All of us would like to have a policy that we could adopt to lower drug prices, and I think that's a legitimate goal. But rushing something out in executive order that had already been rejected by the courts is not the way you're going to get there. Yeah. This is not, we are not going to see lower drug prices because of this executive order.